So when the Center for Medicare and Medicaid Services started to look at readmissions, they came up with 3 that were very, very high on their list, and those were congestive heart failure, myocardial infarction, and pneumonia. And those have been the ones that CMS determined they would penalize hospitals for and stimulate the readmission reduction. That actually has happened. Within the cardiovascular disease categories, right now, obviously 2 of those 3 are congestive heart failure and acute myocardial infarction. We will find out fairly soon that there are likely to be other ones on the way. But for the time being, until the regulations are actually issued, we now have congestive heart failure and myocardial infarction.
Many of the conditions that we deal with in cardiology are very much those that are prone to result in readmission. The major ones are congestive heart failure, myocardial infarction, atrial fibrillation, and conditions like deep venous thrombosis and pulmonary embolism. These are conditions in which the ongoing concern that the patient and their family has leads to a heightened awareness. They are also conditions in which the juxtaposition of complex medication regimen and sudden changes in health status and lifestyle create an anxiety in which the patients and their families are extremely prone to returning for care. That return for care is sometimes not even necessary, but it results in readmission, and that results in increasing cost. The patient with myocardial infarction, for instance, who has recently undergone a stent procedure, will be anxious about the disease. They'll also be anxious about the puncture wound and the physical process of having had the angioplasty. They'll be concerned about bruising. They sometimes have discomfort related to the procedure itself. And if we haven't educated them about it, if we haven't facilitated their transition of care, they will return. We want them to communicate. We want them to be comfortable. And it's our responsibility to facilitate those transitions of care, particularly in these chronic, ongoing medical problems with complex medication regimens, to see to it that we provide that service for them.